Tonight.
The WHO failed in this basic duty and must be held accountable.
Fallout from President Trump's order to withhold funding for the World Health Organization.
One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China.
Why he says the UN agency should have done more to prevent the spread of COVID-19. And
so many people with this crisis who don't have money, don't have the ability to give a proper funeral and burial to their loved ones.
The high cost of funerals causing financial strain during the pandemic. Plus, an unexpected consequence of the coronavirus, sparking a rise in child exploitation online. All this and more tonight on Faith Nation. The World Health Organization calls for unity in the fight against COVID-19. Welcome to Faith Nation. I'm John Jessup. The WHO's Director General says the organization's work to fight coronavirus will continue uninterrupted. That's despite President Trump announcing the United States will stop payments over what he describes as the agency's mishandling of the initial COVID-19 outbreak in China. Capitol Hill correspondent Abigail Robertson has the latest in the dust-up in tonight's top story.
The administration says they will suspend funds to the WHO while they conduct a review into severe mismanagement and early efforts to cover up the virus epidemic.
The reality is that the WHO failed to adequately obtain, vet, and share information in a timely and transparent fashion.
The U.S. is the organization's top sponsor, contributing $400 to $500 million each year.
Had the WHO done its job to get medical experts into China to objectively assess the situation on the ground and to call out China's lack of transparency, the outbreak could have been contained at its source with very little death, and certainly very little death by comparison.
Trump accused the UN agency of being too trusting of China and criticized officials for opposing early travel restrictions against the country.
The delays the WHO experienced in declaring a public health emergency cost valuable time, tremendous amounts of time.
House Speaker Nancy Pelosi responded by saying this decision is dangerous, illegal, and will be swiftly challenged. While Australian Prime Minister Scott Morrison told 6PR Radio he agrees that the WHO was slow to react.
I sympathise with his criticisms, and I've made a few of my own. I mean, we called this thing weeks before the WHO did. If we were relying on their advice, then I suspect we would have been suffering the same fate that many other countries currently are.
But China, who contributes around $20 million annually to the WHO, condemned the United States decision, saying the global epidemic is at a critical moment, and this will weaken the WHO's capabilities. China also claims they've always timely notified the WHO to information on the coronavirus. New reports show, however, China waited 6 critical days in January to alert the public after determining they were facing a crisis. That delay came as millions of Chinese people were traveling for Lunar New Year celebrations, and tens of thousands attended a banquet at the outbreak's epicenter of Wuhan. Back to you, John.
Well, joining me now is Gordon Chang, columnist and author of the book, The Coming Collapse of China. Gordon, you wrote an opinion piece saying that Trump is right to stop funding the World Health Organization and gave 4 reasons why. Can you explain why you say the WHO helped spread the coronavirus?
Yeah. Beijing knew about the human-to-human transmission of the coronavirus. They only talked about it publicly on January 20, but they knew about it well before, perhaps as far back as the second week of December. Well, the World Health Organization helped them propagate something that they knew to be false, and many people in the WHO knew to be false, and that was there was no contagious human-to-human contagion. Also, the WHO helped China, which wanted to pressure countries not to impose travel restrictions and quarantines on arrivals from China. That's how this disease was spread from China to the rest of the world. So you have the WHO supporting Beijing's important narratives, which caused the spread of this disease.
To the argument that the World Health Organization is too closely aligned with China, you mentioned Taiwan in your piece as an example. What are some of the other reasons for that perception?
You could probably go back before Dr. Tedros, who's the current Director General, to Margaret Chan, who was his predecessor. She was the first Chinese national actually to head a multilateral organization. And so China has had the WHO in its pocket for a very long time. And what we're seeing right now, which is a rot at the top of the organization, took many years to actually produce. And that really means that we need the top leadership of the WHO to resign, not just Director General Tedros, but also Bruce Aylward, who's called the senior advisor to Tedros, plus probably a lot of the Chinese nationals in leadership positions. There's a lot of good work that's done by the WHO at lower levels, but it doesn't really have the effect it should have because of political decisions that are being made at the top. These are decisions to support China. They're not decisions to support world health. And that's why it's important for the President of the United States to defund the organization, because we're not through this virus yet. And a lot of people say, well, now's not the time to reform. But if we wait, the pressure will come off and there will be no reform. We've seen that dynamic before. So I support the president's call for doing this now.
Gordon, there's fresh reporting that China has underreported its numbers, both total confirmed cases and in deaths. We see that also playing out in other countries like Britain, and even here in the United States, they're saying that there's a real-time lag. Can you explain why you say these are not the same?
Well, they're not the same. You know, in any reporting, you're going to have some delays. But in China, in addition to that, you're also having deliberate falsification because the gap is too large. And we have seen, for instance, in Wuhan, the epicenter, all of those tens of thousands of urns. Those numbers have not been reported even now. You know, I know if you go back to the early part of the epidemic, you could see that health workers and officials in Wuhan just couldn't keep up with all the deaths. They were just trying to scoop up the corpses from hospital floors and from the streets. And so, of course, accurate reporting was not at the top of the list of their priorities. That's completely understandable. But what we have not seen is the reporting in China catch up for what were obviously the underreporting in the beginning. And that's the real sin.
Gordon, finally, to the origins of the pandemic, it appears the narrative may be changing. Initially, reporting said this new strain of the coronavirus originated from a wet market in Wuhan province. Now there's a fresh new round of reporting that the United States government raised red flags about a lab in Wuhan that was studying bat coronaviruses back in 2018. Does this at all surprise you?
No, it doesn't surprise me. I mean, even from the very beginning, there were two theories, wet market and a release from a lab. But one thing we couldn't find out, though, was because Beijing was preventing the foreign community from actually studying the origins of the outbreak. And what we have been learning recently is that the particular bat in question that is supposed to be the source of the coronavirus, that bat wasn't sold at the wet markets. So if you eliminate the wet market theory, then the only other possible source is one of those two laboratories that Beijing maintained in Wuhan. And we know that Beijing has been, as I mentioned, trying to suppress investigation. So they've got something to hide, which means that a release, an accidental release from one of these labs is the most probable theory.
If it was created in the lab, what do you think the motive was?
Well, China has been storing coronaviruses for a long time. And I think this was an accidental release. But we've got to remember that Beijing's motives were malign. They knew for probably about 6 weeks that this was human-to-human transmissible. Not saying anything about it was dangerously irresponsible, but actually trying to mislead the international community to say that it wasn't transmissible. And then on top of that, trying to get countries to accept travelers from China. You know, I don't know what was in the leader's mind, Xi Jinping, but if ever seen the devastation to China, if he wanted to deliberately spread this to other countries to get even, well, he would have done exactly what he did. and the WHO helped him. That is the sin. Between the Communist Party of China and the World Health Organization, they took what should have been a localized outbreak in the center of China, and they made it into a global pandemic.
All right, Gordon Chang, again, thank you so much for your time. We're going to have to leave it there.
Thank you, John.
Well, as government leaders wrestle with how and when to reopen the country, the decision likely will come down to individual states. CBN News national security correspondent Eric Phillips joins us now. Eric, increasingly we're hearing from state and local leaders, and while some places are talking about reopening, others are telling residents things might be closed for quite a while longer.
Well, John, that's exactly right. And as a matter of fact, just today we heard from the mayor of Washington, D.C., who extended the stay-at-home order there until May 15th. That's in the light of that city's very rapidly growing problem there. The growing question on everyone's mind is not as much if, but when we will be open for business. The president has floated a May 1st timeline, but some health officials say not so fast.
If we are assuming that 2 weeks from now, that all the curves are going to be down, I think that's a bit overly optimistic.
His counterpart at the CDC, however, willing to go a bit further during an interview Wednesday morning.
There are a number of states, 19, 20 states, that really have had limited impact from it. So I think we will see some states that are the governors feel that they're ready. We're poised to assist them with that reopening.
Individual governors will play a pivotal role in this process. California's Gavin Newsom painting a picture of his view of a new normal.
You may be having dinner with a waiter wearing gloves, maybe a face mask, dinner where the menu is disposable, where your temperature is checked before you walk in to the establishment.
Others aren't quite there yet, especially in areas like Louisiana, which has just experienced its deadliest day thus far from COVID-19. Also, nearly 430 workers at a pork processing plant in Sioux Falls, South Dakota, are now sick, with more than 100 people now testing positive. The governor there has resisted a statewide stay-at-home order.
Regardless of a shelter-in-place order, this plant would have been up and running because it is exempted as an essential business.
The Sioux Falls mayor, however, is sounding the alarm.
We're growing increasingly concerned about the need to mitigate that spike before it overwhelms our hospitals.
And from the epicenter, New York City, Mayor Bill de Blasio is calling for an increased use of face masks while sounding cautiously optimistic.
When it comes to the daily number of people admitted to hospitals for suspected coronavirus conditions, that number has gone down, I'm happy to say.
But the state has seen a surge in nursing home deaths, a major concern.
It's over when we have a vaccine. It's over when people know I'm 100% safe and I don't have to worry about this.
Yeah, until then, worldwide European countries are following the lead of the United States and hoping to ease restrictions. The World Health Organization warning, though, that it cannot happen all at once and that the proper controls need to be in place before it does. John.
All right, thank you, Eric. Coming up, a new normal for funeral homes. How the pandemic is forcing the industry to adjust.
Having sex before you're married is a bad idea.
Don't tell me there's no such thing as gun violence.
That just depends on your definition of when life begins.
Watch Dan and Dale tackle trending topics that test your faith on the next Faith Wire, Monday night at 9:30. The Global Lane takes you around the world, providing facts over fiction.
What might rising trade and geopolitical tensions mean for you on the home front?
With over 45 years of experience, award-winning journalist Gary Lane brings you the truth from a global angle.
What about the issue of immigration?
World news analysis you won't see anywhere else.
And it's all right here on the Global Lane.
Watch The Global Lane, Thursday night at 9:30.
Well, welcome back. Lawmakers in New York want the federal government to help people with the cost of COVID-related funerals. Nearly a third of all coronavirus cases in the United States alone come from New York, with more than 10,000 deaths statewide.
It's bad enough people are losing their jobs and don't have food to eat, are separated from their families and loved ones. But to not be able to give a decent funeral and burial to someone who is near and dear to you is outrageous.
Senate Minority Leader Chuck Schumer is proposing money from FEMA, saying it should be used to help fund funerals. He also said it was done after Hurricane Sandy and that the Federal Emergency Management Agency should do it again now in the wake of the coronavirus. If not, he says he'll include burial funding in the next COVID-related bill. Well, even though the cost of funerals hasn't changed, the services themselves look much different due to the pandemic. Mark Martin brings us this look at how families are having to change the way they honor their loved ones.
For now, the sight of long lines filing past a casket to pay respects are on hold. Funeral homes must adhere to new guidelines. It's a big change for Mike Strickland, GM of Family Choice Funerals and Cremations.
We are going to follow all the necessary guidelines, of course, limiting 10 people or less to these services. We are using all of our personal protective equipment. So we just want people to use common sense, and that's what we're doing. This is an evolving thing. You know, the more we know, the better we are. But 6 feet away, 10 people or less, you know, we're just using, common sense.
Right as you enter the funeral home, you encounter what Strickland calls the sanitation station. There are masks, gowns, tissues and gloves, wipes, and even hand sanitizer.
We want to keep everybody safe, and we want to be safe as well. And we tell families, if you're sick, stay home. We can email you everything.
Strickland's staff is working with one family whose deceased loved one suffered from COVID-19.
That is concerning to me and to the staff. So when we call the hospital or the place of passing, we always ask. And if the person does have it or has been exposed to it, we gown up, put gloves on, face mask. And that family that we have served, we have emailed.
He tells CBN News he's using technology to work with the family remotely.
Families are understanding, so if we have to do everything through the email or Facebook Live or something like that, people are understanding.
Strickland explains how they now handle graveside services by sharing a recent example.
The family was able to follow us to the gravesite, but they had to stay in their car. And they saw us go ahead and bring their loved one out of the hearse and place it at the graveside.
Strickland calls this current season uncharted water, and he's taking it day by day. Mark Martin, CBN News.
On the home front.
Thanks for joining us for CBN's On the Home Front, where we highlight what the men and women of America's military do to defend our country. CBN honors the men and women in our military with an initiative called Helping the Home Front. It partners with churches across the country to meet the needs of their military families, from repairing homes to wiping out medical bills for wounded veterans.
On the Home Front, Tuesday morning at 10:30.
If you want to be an attorney with a passion for serving people and for excellence, Regent University needs to be high on your list.
Regent's award-winning law school doesn't just create lawyers. We create leaders, judges, prosecutors and defense lawyers, civil litigators, and leaders in government.
My focus has been trying to really make sure we have the future leaders we need for the bench and the bar and for society generally.
You'll learn from highly credentialed leaders who are current and former judges, distinguished scholars, and ACLJ counsel.
I'm so glad I chose Regent. The relationships here have been amazing. The faculty have been amazing. Not everybody's called to the same thing when they leave law school, but they're called by a God who has a purpose for their lives, and He is going to use that education to make a difference in the world.
Regent will prepare you to be a purpose-driven, practice-ready lawyer. To start your rewarding law career, complete the online application, submit your transcripts, and take the law school admissions test by July. Apply today.
Well, you can call it a pandemic within a pandemic. We're talking about the huge rise of child exploitation on the internet. Experts say now, with more children at home during the coronavirus pandemic, parents are the first line of defense when it comes to protecting their kids online. CBN Chief Political Analyst David Brody joins us now with more. David?
Well, John, the big, very influential and popular website called Pornhub has actually seen a dramatic increase in traffic. And as a matter of fact, Pornhub, in addition to that dramatic increase, in Europe, in certain countries, they're actually offering their service for free. And you might imagine traffic went through the roof. You know, more than 50% of preteens are on their phone, even more now during the coronavirus. And that's a real problem for a lot of advocates, especially in this area, especially Donna Rice Hughes. She's the CEO of Enough is Enough. They fight child exploitation. We had a conversation about that.
Sexual predators and sex traffickers, I include those in the same category because they use the same tactics. They are looking for vulnerable children constantly. And where kids play, predators prey. And so the fact now that kids are at home more, they may be using technology more, means that parents need to be even more vigilant. Child pornography images, for example, are exploding. They have exploded. There are over 45 million that were reported last year. Those are just the ones that are reported. And many of these kids are very young, children and infants. And we know from the Department of Justice that they cannot prosecute their way out of this. We're trying to get them to start to prosecute the hardcore obscenity laws, which they haven't done since John Ashcroft was in under Bush 2. So really a lot of the burden does fall on the parents, and we've got all the information they need to learn how to protect their kids at internetsafety101.org. Now, what we're really pushing for is to get this Department of Justice to aggressively enforce the obscenity, and that's the hardcore graphic content. And kids, David, I'm sorry to say this, I know that this is another scary thing, but you've got to hear this. Kids as young as 10 years old, 8 and 10 years old, make up about 25% of the porn users of the under 18 category. Wow. And I know it's crazy. And 10 to 14-year-olds make up 36% of the under 18 category. And they're not looking at the soft stuff. They're looking at sexual assault content. They're looking at violent content. They're looking at anal sex. This has become their sex education model, and they are modeling this behavior. So we've got to recognize that we are in a spiritual war. Yes, we have got to get these laws enforced because we're the top producer and distributor of this content in the world, and it drives demand for trafficking victims. It drives demand for the child sex abuse images, and it's driving so many things, and it's straight from the pit.
And look, John, there are 16 states in America that have actually made pornography a public health crisis, Alabama being the last one to do so. Got to tell you, though, even though it's considered a public health crisis in these states, not much teeth behind that at all.
David, real quickly here, is Congress doing anything to address this?
Well, specifically, they want more of those obscenity laws to be enforced. But beyond that, Senator Ben Sasse actually is calling on a federal investigation of Pornhub because they believe Pornhub is actually showing videos of not just minors, but minors in sexually explicit detail and as well as sexual trafficking situations online. They want that investigated.
All right, CBN's David Brody. Thank you, David, for that very important report. Helping meet the spiritual needs of first-line responders. How many are turning to faith amid the COVID crisis?
If you want to be an attorney with a passion for serving people and for excellence, Regent University needs to be high on your list.
Regents award-winning law school doesn't just create lawyers. We create leaders, judges, prosecutors and defense lawyers, civil litigators, and leaders in government. Ready to become a purpose-driven, practice-ready lawyer? To start your rewarding career, complete the online application, submit your transcripts, and take the law school admissions test by July.
Nutrition, exercise, essential oils, weight loss, and more. It's Healthy Living with Lori Johnson.
Talk about what's in this.
Join CBN health reporter Lori Johnson to get the latest information from today's top health experts.
This is fantastic.
Find out what you need to know to live a healthier life. Watch Healthy Living, Tuesday night at 9:30.
Woohoo! Hi, Superbook fans. Here's something else you'll love. It's the new Superbook Bible app. It's packed with games, activities, and Superbook episodes that you can watch for free. Oh no! There's trivia, a fun daily devotional, and answers to your Bible questions. Plus, an easy-to-understand Bible the whole family will enjoy. You can even create your own Superbook character. Ta-da! Whoa!
No Spur Falls, man. Come.
Sorry, pardon me. Sorry, excuse me. Ouch!
Are you getting this?
Earn super points to win daily prizes, too. And so much more! Time to get back to my adventures. See you soon! It's the new Superbook Bible app. Free downloads on iTunes, Google Play, and Amazon.
Young people, millennials, are flocking to church.
It's not an exaggeration to say that we love to meet them and that we love to know their stories.
And finally tonight, in the face of the global pandemic, many are relying on their faith. In Kansas, 2 women are putting faith into action, organizing a prayer walk around a local healthcare facility that's facing a COVID-19 outbreak.
We're literally praying for walls of protection, God's protection, to come up. And so it's just a declaration of faith.
The prayer walk was created as a show of support for the nurses and first responders working at the rehabilitation home, so that not just physical needs are being met, but also spiritual needs as well. Well, thanks for watching and good night. We hope to see you right back here tomorrow.